our show, Health and Wellness, Myths and Facts. I'm Gargi Rawat. The term heart disease refers to different types of heart conditions. While most of these conditions are preventable, heart disease is the leading cause of death in both men and women globally. Indians develop heart disease 10 years earlier than those in Western countries, unfortunately, and nearly 3 million individuals die from stroke and heart attack each year. The most worrying part is that among the heart attacks, 40% are below the age of 55. The COVID pandemic has exacerbated the cardiovascular disease burden. When people are informed about the risk factors, they can take precautions or manage their symptoms at the earliest and reduce the risk of heart attack, heart failure, stroke, or sudden cardiac arrest. We have with us experts who will give us the correct guidance and tell us about how we can prevent these diseases. Also, if you have any questions, do send them to us on WhatsApp. The numbers will be flashed on your screen. So any questions to our doctors, do send in your your questions on that number. And now we're joined by Dr. Dilip Kumar, Senior Interventional Cardiologist, Medica Super Speciality Hospital, Kolkata. Dr. Rajeev Agrawala, Chair, Department of Cardiology, Jaswant Rai Speciality Hospital, Meerut. And Dr. J Ezhilan, Senior Consultant Cardiologist, Madras Medical Mission, Chennai. Thank you so much, doctors, for taking your time out and joining us on the program today. Dr. Agrawala, I'd like to start with you. And heart attack, cardiac arrest, and other cardiovascular diseases have remained a major health concern around the world. But more recently, there's a rise in the number of cardiovascular problems, especially among the younger population. Why have heart attacks become so prevalent in the young?
Thank you and good afternoon to the viewers. I think that is a very pertinent question. You said that it is less than 55 years of age. I think at least 30% of our patients are less than 40 years of age. So the age is still younger. Diabetes and smoking, they are coming on a younger side of our population, and they continue to be major risk factors. What interests me these days is three things which has happened because of the digitization of the world. Physical inertia, or I call it physical hygiene. We have become sedentary, and everyone is supposed to walk at least 10,000 steps. If you sit for 6 hours, it is as bad as smoking a pack of cigarettes. Sleep hygiene is another problem. Because we are interacting with the rest of the world, our sleep cycle is disturbed, and that stimulates the secretion of bad hormones which are bad for the heart. And the last thing which I think which is new is emotional hygiene. The youth has got too much of a pressure, greed, hostility, anger, trying to settle down everything. That again goes in favor of developing diseases like diabetes, high blood pressure, and cholesterol. So to summarize, our risk factors are shifting towards the younger age, and that is probably the reason for younger heart attacks in our population. Thank you.
All right, and the reason to have healthy habits from an early age and not think that we'll change it after 50, since heart disease is catching people young. Dr. Ezhilan, many of us have irregular daily routines. Many times we have to stay late nights in office. Does all this affect your heart health, and what precautions would you suggest?
Yes, definitely. Both work stress and lack of sleep, both can adversely affect your heart health. At work, we have to be clear what is expected from us. We should have a schedule planner for your work so that things don't crop up suddenly. Keep a track of your projects and deadlines. Avoid conflicts at workplace and balance your professional and personal life. I think that should reduce your work stress. And sleep deprivation will definitely cause symptoms like fatigue, irritability, mood changes, lack of concentration, and memory loss. All this will lead to diseases like diabetes mellitus, obesity, high blood pressure, heart failure, heart attack, stroke, and depression. So these are the various diseases you can get if you don't sleep well. That is why the American Heart Association and American College of Cardiology have recommended that one should sleep at least 7 hours per day for an adult. So I think if we take care of our job stress and sleep adequately, we can avoid heart problems to a certain extent.
All right, so lots of healthy habits there being suggested. Dr. Kumar, can a young person survive a heart attack, and what are the signs and symptoms young people should look for early diagnosis of heart disease?
So thank you so much and good afternoon, everyone. And if young people, they get a heart attack, they do survive. And thanks to the, penetration of thrombolytic therapy, which is available in the smaller towns even, and better infrastructure in even tier 2, tier 3 cities where primary angioplasties are getting done. So young people, they do survive, and especially this is a fact that if a young patient develops heart attack and if the treatment is delayed, the damage to the myocardium is massive because they don't have any ischemic preconditioning. So better not to do any delay. Treatment has to be given as early as possible. And coming to signs and symptoms, everyone who is feeling, shortness of breath on exertion, he is feeling chest discomfort while climbing stairs, on, moving around on, normal activities, they should get themselves checked as early as possible. And even for normal people who are more than 40 years, they should go and get themselves checked, like ECG, echo, treadmill test, and some blood tests. These are very important. But for someone who has a cardiac, bad family history of cardiac disease, had a family history of, premature death because of any cardiac ailment, or he has multiple risk factors like smoking, diabetes, they should get themselves checked even at 35 years or even earlier. Yeah.
All right, so those are things to watch out for and when you should get yourself checked. Dr. Agrawal, what can happen if a person doesn't receive rapid treatment for a heart attack? And this is something I think in India we need to promote first aid and how to react to a crisis situation. So if you could tell us about this.
You see, this is a very interesting question, and in medicine we say time is muscle. Earlier you get treatment, more the muscle you save. And the first hour of heart attack is called the golden hour. As you know, if we delay that treatment and prolong the time to treatment, it is common sense the muscle loss will be permanent and bigger. It becomes, in many patients, a cause of concern over a period of time. What we see in common language, heart enlarge ho gaya, attack ke. That is a very, very serious outcome of heart attack. So the treatment of heart attack should not have patient inertia, that we have a sense of denial that it is not heart attack, it is gas. We should reach to the hospital early, and there are two treatments. One is, like my colleague said, opening the artery by drugs, and another means is opening the artery by mechanical means, what we call angioplasty. And you should force the hospital to give you one of these two treatments as early as possible, so that you have minimum injury during heart attack and you come out with a healthy heart after a heart attack, a stronger heart, and the future course of events is minimized. Thank you.
All right, Dr. Ezhilan, if a person receives treatment after a heart attack, then how likely is it that he can get another heart attack?
Yeah, reinfarction is what we call it. That is getting another heart attack after you have already developed a heart attack. It can be as close as just 1 or 2 days later, or up till 1 year. The incidence of reinfarction is 3% within a month, not very large. But at 10 years, it will become 25%. So definitely you will develop a reinfarct likely. Reinfarction has a higher mortality and you develop more complications. By revascularization, what I mean by revascularization is, after having had a heart attack, you undergo an angiogram, and if you have significant blocks, you undergo angioplasty or bypass surgery. That is revascularization. So if you undergo revascularization, you can bring down the incidence of reinfarction. So that is why guidelines recommend that once you have developed a heart attack, within 24 to 48 hours, we should undergo an angiogram. And it is not necessary that after an angiogram, everyone needs revascularization. Many a times we find non-critical blocks and we might leave them on medical management also. But however, one should undergo an angiogram immediately after a heart attack so that the incidence of reinfarction is reduced. And what happens is, every time you develop a heart attack, 10 to 15% of your muscles get damaged. If more than 40% of your muscle gets damaged, we go for cardiogenic shock. Patient cannot survive. Invariably, it will be fatal. So that is why we can sustain only 2, maximum 3 attacks. Beyond that, it is a risk to the life. Hence, once we develop an heart attack, kindly undergo an angiogram and revascularize.
All right, Dr. Kumar, if your body weight is in control, does it mean a person's blood lipid levels would be normal and he or she cannot get heart disease?
Thanks for asking this question. This is the biggest perception one can have. So if you are a thin built and body weight is under control, you shouldn't be feeling assured that you are not going to have cardiac disease. So there are patients who have a normal body weight and cholesterol is in sky high. So we have a disease like familial hypercholesterolemia, where the LDL levels, what is called bad cholesterol, which is in range of 190, 200, even more than that. Sometimes we see 300, 400 LDLs, and their phenotype is thin. And they have some subtle other signs of familial hypercholesterolemia, and they can have very high chances of cardiovascular disease, advanced accelerated atherosclerosis. So one should not feel assured, and that is the bottom line. But at the same time, one who is obese, a person who is obese, he definitely has an additional risk factor in terms of forms of obesity, and he has to be, watching his other risk factors. But someone who is thin, who is body weight in control, should feel relaxed, but should not feel assured. He should be screened as a normal person at 40 years, or if has a family history or other risk factors, they should be screened as per the recommendations.
All right, well, we'll slip into a short break right now and return with many more questions we have for our doctors regarding heart health and healthy living. Welcome back to our show, Health and Wellness, Myths and Facts. And we're asking our doctors about heart health and what we can do to preserve our heart health. Dr. Agrawal, how does exercise help in lowering the blood cholesterol levels? Now, there's good cholesterol as well, and can exercise affect the good cholesterol levels as well?
Yes, exercise, we call it as a polypill. Polypill means that it is a remedy for many diseases. We have two types of cholesterol. One is called the LDL cholesterol, which is a bad cholesterol. It gets deposited in the arteries and clogs them. Another is an HDL cholesterol, which is a good cholesterol, what we call as scavenger cholesterol. So if you have a good balance between these two, you are well off. Most of the people who have disease have higher LDL. Those who don't have disease usually have higher HDL. More you exercise, more is the HDL. But the unfortunate part is you do an exercise, stop it for a week, it gets back to the same level. So exercise has to be in continuity. Many of us believe that different kinds of alcohol increase HDL. That is a myth. There is no prescription from doctor's side to increase HDL and take alcohol. So another problem is there is no drug till today which effectively increases HDL and translates its advantage to the individual. So there is only one way to increase HDL and protect your heart is exercise. It not only improves your cardiovascular status, it reduces the incidence of diabetes, high blood pressure, it improves your cholesterol. Even the incidence of cancers is low with exercise. So exercise is a remedy for many things, and I call it a polypill. Thank you.
All right. Well, speaking of exercise, Dr. Ezhilan, I'd like to ask you about high-intensity exercises. And can high-intensity exercise acutely increase the risk of a sudden cardiac arrest or sudden cardiac death in individuals who have had no prior history of heart disease? You know, in recent days, we've heard of a couple of people, celebrities even, passing away when they're in the gym or after exercising.
Yeah. Yes, high intensity exercise actually can increase the risk for sudden cardiac death, but that is not in normal people. It is in people who already have an heart disease, but they are unaware of it. In those people, sudden increase high intensity exercise can definitely cause more mortality. What happens in sudden cardiac death? The patient dies suddenly. So how does that happen? The most common cause for sudden cardiac death is ventricular fibrillation. What we mean by ventricular fibrillation is normally the heart contracts at around 70 per minute. So the heart has 800 milliseconds to fill and 500 milliseconds to eject the blood out. In ventricular fibrillation, the heart beats at a rate of 600 times per minute. So literally there is no time to contract and relax. The heart stays still. No blood comes out. The brain can withstand only 4 minutes without blood. Beyond 4 to 7 minutes, the brain dies and then the individual dies. So that is sudden cardiac death. The most commonest cause for sudden cardiac death is coronary artery disease. That is blockages in the coronary arteries, what we commonly call heart attack. So people, they will have blockages in the coronaries, but since the blockages are not tight, they would not have had angina or chest pain before at all. Suddenly they develop heart attack, develop ventricular fibrillation and die. So this is the commonest cause for sudden cardiac death. In addition, there are many cardiac conditions, for example, hypertrophic cardiomyopathy. It's a condition where your heart muscles are genetically very thick. In this, when the muscles are very thick, it obstructs blood coming out. So these kind of patients, after exercise, they are prone for sudden cardiac death. The most common cause of sudden cardiac death in athletes is hypertrophic cardiomyopathy because it affects younger individuals. Coronary artery disease affects a little older individuals. In addition, there are many newer, many diseases, like for example, anomalous coronary arteries. You have blood vessels supplying the heart. They normally travel above the heart. In case they are arising abnormally, and then they have to cross the two great vessels, they can get pinched by the two great vessels, and then you can develop sudden cardiac death. In addition, myocarditis, other cardiomyopathies are also some of the causes for sudden cardiac death.
All right, Dr. Kumar, now coming to the bad habits, and is it true that people who smoke develop cardiovascular disease earlier than those who don't, and could even die before they know that they have any sort of cardiac disease?
Yeah, thank you for bringing up so many important issues. So smoking, we call it as invited curse for mankind. So this problem we have invited, and this is the single largest preventable cause of death. So smoking basically it accelerates the atherosclerosis. It can cause diffuse coronary artery disease. It can cause peripheral arterial disease. It can cause plaque ruptures and sudden myocardial infarction, and patient can die. It can also trigger many arrhythmias. So I take the opportunity and your platform to appeal to everyone that we want a nicotine-free country. And smoking not only causes cardiovascular disease, but it can cause multiple kinds of cancers. So right from GI cancers to lung cancers. So it is really debilitating, and I see many patients on whom we have performed primary angioplasties. We have saved the patient, young patients, and they carry on their habit of smoking, and they land up again with a reinfarct, restenosis of the stent, and arrhythmias, and they again get admitted. So it's really painful. So finally, the appeal goes on, and if a single viewer quits smoking after seeing this program, I think our appeal is addressed and your program is successful.
All right, Dr. Agrawal, if a person doesn't smoke and if his or her cholesterol is within normal limits, then what impact does family history of heart attack have on their risks?
That is a very good question from community's perspective. Often we forget our family history, and each one of us sitting as doctors on your panel must have witnessed patients after patients coming from one family. And they do not acknowledge that the family history is very important. What constitutes family history is parents having a heart disease less than 55 years of age, or your siblings, cousins having heart disease constitute family history. These patients not only have heart disease, but they manifest at a younger age. That is another problem. So I tell your audience to download one app called ACC AHA Risk Calculator. ACC AHA Risk Calculator from any app store. And it is simple, patient friendly. You can calculate your risk and multiply the number of individual in your family having a heart disease, and that will tell your risk. If you are a higher risk person, more than 10% or so on the risk calculator, then you have to be very preemptive, proactive in your risk factor management. The another way to look at it is coronary artery calcium score, which is done on CT scan. If you're a normal person, should have a score of 0. If you have a family history and high calcium score, you have already begun the disease. So don't neglect your family history. It's very important, and you should take note of it rather than forgetting and waiting for your turn. Beware of your family history. Thank you.
All right, so need to be aware and conscious of family history as well. Dr. Ezhilan, youngsters have been adversely affected by the lockdown. The active lifestyle has been paused while screen time has increased. Will this lead to more people suffering from hypertension?
Yeah, definitely. This is a more pertinent question for the current scenario. Almost 2 years we have been in this pandemic, and most of the time we have been in lockdown also. So children, they are not able to go to school, they are not able to go to playgrounds, they are not able to go to gyms. So physical activity, whatever we were doing, has come to a halt. Instead, what they do, they sit in front of TV screens, they see movies, or they play games online. So all this leads to sedentary lifestyle. They are not doing any exercise also. And we know lack of exercise is a very important risk factor for developing hypertension. So this leads them to hypertension. In addition, what they do is they try to eat snacks while watching TVs or movies at home, and they take more snacks which contain high salt content. So that is another risk factor for developing hypertension. So that will also lead to hypertension. And they also have stress and fear because of the pandemic. I mean, you don't know who will suddenly develop COVID, their parents or their siblings might develop COVID. So they have that fear and tension, whether you will also develop COVID if you go out. And that fear also leads to high blood pressure and hypertension. So I think all these factors in this pandemic has definitely led to more incidence of systemic hypertension in younger individuals.
All right, so I think that was all, created a lot of awareness for people, especially for younger people, to be aware that they could also suffer from heart disease if they're not careful, and to watch out for those warning signs. Thank you so much, doctors, for joining us on the program and speaking so extensively and answering all our questions. Thank you all for watching at home. Goodbye.